Hello everyone. Thank you for watching another episode of Ask Dr. Bob, and we have a lot of questions today, all very good questions. Please pass this information on. Dr. Bob, I have all your books, and my husband and I love them. I just ordered again from your site, all the supplies. I have a question about iodine. They found a fibroid on my uterus. Let me tell you this. Fibroids on uterus are usually too much estrogen. We use a product called calcium D-glucarate to get the excess of estrogen out of your body. As far as the question goes on, how much iodine should you take? I take 12 milligrams of iodine every day. The most scientific way to determine how much iodine you need is to do a urine iodine loading test, or for sure have your T4 tested. Fibroids, think uterus. Thank you for the question, by the way. I had a very detailed question about PCOS, polycystic ovarian syndrome. I know the medical community wants all the women to start taking metformin, which is a drug they use for pre-diabetics. I was actually shocked the very first time I read and I heard about this. Metformin, they say, works because it reduces inflammation. I want you to know this. PCOS, from my experience with treating just thousands of ladies, is lack of iodine. Now, going back to the question just above, you may consider a urine iodine loading test to determine how much iodine is in your body. You want to stay away from bromine, fluorine, and chlorine. That means you want a shower dechlorinator. That means you want toothpaste without fluoride in it or fluorine in it, and you want to drink with reverse osmosis water. If you do that and start adding iodine to your life, your PCOS will go away. Other than the ABCs, what else should I be eating on a daily basis for optimal health? Vegetables, non-starchy vegetables, and organic protein, because that's what Dr. Bob does. Organic animal products, organic vegetables, non-starchy, and I will eat some dry rice cereal with walnuts, shredded coconut, and 8 or 10 organic raisins. And of course, a rice cake with almond butter and coconut oil. Is D3 capped a good source of D? I use a vitamin D that I put the drops directly on my tongue that bypass digestion. I take between 2 and 3 drops every day. I would encourage all of you watching me right now to have your vitamin D tested at least once a year. You want a level of 40. If you happen to have dark skin, whether you have African American or from Jamaica or anywhere in the world, or if you're Indian, that's Asian Indian, and are from the Mideast and you have dark skin, and or if you're not outside, trust me, you want to be on vitamin D, especially this time of year, because vitamin D, I have seen it help take away bronchitis. And the reason vitamin D works, it takes the calcium from your intestine and puts it in your blood. And that helps glue membranes together. Dr. Bob, I'm 43 years old. My globulin is 3.3 and my albumin is 3.7. I have digestive issues and constipation all my life. I have a slow digestive system. Any suggestions? Well, here's what I would suggest. First, if your globulin is 3.3, you probably have your hand in the cookie jar. And you're probably eating too many cookies or products that are lowering your digestive enzymes. Yes, you do need a digestive enzyme to absorb the protein. You probably need to eat more protein. I just did an organics urine test on someone. They needed to add B6 to their life to help their body process the protein, something that I wanted to pass on to you. And who's ever watching this and their globulin is high, we do have a new test that we've incorporated called the Organics Basics. And what I just helped this gentleman with today was huge because he's eating a lot of protein, but he needed B6. Are you able to substitute lemon with lime instead? I can tell you this. Lime has less vitamin C than a lemon does. Hi, Dr. Bob. In regard to making protein for your hair, the spray, what would you suggest? There's a product we use called Amino Quicksorb. Put a couple squirts in maybe 8 or 10 ounce spritzer bottle and just spritz it on your hair. You could also use a product called Caloret. Go online, Google Caloret, and that's where I get it, is online. And I take a tablespoon in the morning, a tablespoon at night. Dr. Bob, Hi, Dr. Bob. I recently started following you. I'm listening to you on YouTube. I began to follow your ABCs, but I'm in the current IVF in vitro cycle, looking to transfer on Saturday. Other than the ABCs, what else should I be eating on a daily basis? Green vegetables and protein, and make sure you're taking some iodine. Wow, that was a lot of information. You should have learned. Take your iodine, everybody. It's really important. Pass it on. This is the vitamin D season. Thank you so much. I'll talk to you all next week.